रहीम टुडे वी विल स्टडी GIT फार्माकोलॉजी। तो जो फर्स्ट टॉपिक हमारे पास है दैट इज़ द H2 रिसेप्टर ब्लॉकर्स एंड PPIs। H2 रिसेप्टर ब्लॉकर्स मीन हिस्टामिन 2 receptor blockers and PPIs mean proton pump inhibitors. These are the drugs that are used to decrease the acid production in the stomach. So first we will see the normal physiology of this hydrogen potassium ATPase pump. So this hydrogen potassium ATPase pump pumps one potassium into the cell and one hydrogen into the lumen. Now this we will see that how this histamine acts on the H2 histamine receptors. Firstly, from where the histamine comes, histamine is released initially from the enterochromaffin like cells which are activated by the gastrin because they have the receptors for gastrin. So when the histamine binds to H2 receptors, adenylyl cyclase is activated and cyclic AMP levels increases. Protein kinases are activated and these protein kinases then activate the hydrogen potassium ATPase pump. As a result, acid secretion is increased. Now if we see how the gastrin is released by the G cells into the bloodstream, and the G cells are present in the antrum of the stomach. From the bloodstream, this gastrin enters the submucosal tissue of the fundic glands and bind to the CCKB receptors on the enterochromaffin-like cells. Gastrin also stimulates the parietal cells to secrete hydrogen ion, but this is a very minor effect. Then we will see what's the role of acetylcholine in the acid release. Acetylcholine is a potent activator of the parietal cells. Stimulation of the vagus nerve causes the release of acetylcholine. Acetylcholine binds to the M3 receptors on the parietal cells. Stimulation also indirectly promotes the acid secretion by stimulating G cells to secrete gastrin via GRP, that is gastrin releasing peptide. Now we will see the H2 histamine receptor antagonists. All of these will be having the suffix of tidine. Like we have the rentidine, cimetidine, famotidine and nizatidine. What they do, they reduce the acid secretion stimuli by pharmacological use of these H2 histamine receptor antagonists. They are especially effective in inhibiting the nocturnal secretion of acids, which depends largely on histamine, but have only a modest effect on meal stimulated acid secretion when the vagal nerve is directly stimulating the parietal cells with full force. So we mostly use these histamine receptor blockers for inhibiting the nocturnal secretion of acids and not meal stimulated acid, according to what's written in your book Sketchy. They are also effective for the treatment of GERD, but proton pump inhibitors are preferred over it. Patients can take H2 receptor blockers intermittently for frequent heartburns or regularly for more frequent symptoms. If GERD is associated with esophagitis, then proton pump should be inhibited directly by proton pump inhibitors. H2 blockers treat duodenal and gastric ulcers by nocturnal acid suppression, but proton pump inhibitors are first line. So what's the adverse effects of the H2 blockers? Mostly they are safe and the side effects are uncommon, but few side effects are mostly related to the cimetidine. Cimetidine inhibits the cytochrome P450, therefore the half-life of the drugs metabolized by this system prolongs. For example, warfarin. The anti-androgenic effect of cimetidine, that is really very important. Cimetidine inhibits the binding of dihydrotestosterone to androgen receptors and inhibit the metabolism of estradiol. Long-term use of the cimetidine result in the gynecomastia and impotence in males and elevated levels of serum prolactin that result in the galacturia.